مساء I'm going to give a brief برضو عن retinal stains or stains in general regarding the retina. First of all, why do we use stains? Retinal stains are vital dyes or particulate suspensions used during the retinal surgery too. Many reasons actually, but on top would be the enhancing visualization of transparent or semi-transparent intraocular tissues, aid in membrane peeling, any membrane, reduce operative time and the iatrogenic retinal trauma. And actually, there is a name was given to stains, the vitreoretinal surgeon low vision aid. First thing we're going to talk about is triamcinolone acetonide or TAA. Actually, that's not a stain, it's not a dye. It's a corticosteroid suspension. Its chemical formula is written here and it's white crystalline powder. We have two options, the preservative-free and the preserved form. And it's insoluble in water, that's why it's suspended. Triamcinolone acetonide aids in visualization as a point, and on the other hand, it's anti-inflammatory. This is how it's injected. It stains and identifies the posterior hyaloid retinal membranes, detecting the residual vitreous cortex, and this is extremely important actually. There is something regarding تحضير triamcinolone acetonide. This is a tip from Dr. Tarek actually. First of all, we get the vial. The vial is 4 milligram per milliliter. We get the full vial in a syringe, 5 cc syringe. And then you just add 3 cc of the irrigating solution, whatever it is, and just leave it in a horizontal, in a vertical position, the tip facing upward, and just the plunger down, and leave it for 10 to 15 minutes, just for the powder to settle down, okay? And then we're gonna remove all the fluid on the top, and then add 2 to 3 cc of the irrigating solution, and then injecting it intraocular. All this just to remove the toxic effect of the alcohol base in this solution. The TA can cause intraocular pressure rise, can cause cataract, posterior subcapsular cataract, can cause retinal toxicity, especially the preserved form. That's why we prefer the non-preservative form. It can cause something called pseudohypopia post-operative. It can mimic an infection, but actually without all the other signs of infection, so that's not scary at all. The second stain is the BBG, or the brilliant blue stain. Actually, it's written BBG, but it's here brilliant blue stain. G stands for G250, and it's like a strain from the brilliant family. The brilliant blue stain, it's actually a stain, that's a dye. It's called acid blue 90, it's a molecular formula, and its appearance is blue, bright blue solution actually. The BBG or the brilliant blue stain has selective affinity for the internal limiting membrane, type 4 collagen. It stains mainly the ILM. That's how it's put under fluid, and this is under air. The BBG has hazards too. It's retinally toxic because of the polyethylene glycol. But this actually rarely happens at concentrations from 0.025% to 0.05%. May occur if the concentrations are too high or the exposure time is prolonged. So it's advisable to use the approved concentrations, limit the exposure time to 30 to 60 seconds, and avoid repeated dye injections as much as we can. Third stain is trypan blue. Trypan blue is also a vital dye. That's its chemical formula, and it stains epiretinal membranes primarily, anterior lens capsule, actually the whole lens capsule, PVR, occasionally the ILM. Trypan blue less specific for ILM compared to BBG, of course. Potential retinal toxicity at higher concentrations also is valid here, and may cause staining of the posterior lens capsule during working vitrectomy, and this is actually might hinder visualization. The fluorescein stain. Fluorescein is a water-soluble dye. It's used for angiographic imaging in retinal and choroidal vasculature. Its chemical name is fluorescein sodium. That's its molecular formula, and like we all know, it emits a green fluorescence upon excitation with a blue light. Fluorescein is used, just like we all know, pre-operative for assessing the retinal and choroidal vasculature. But it's also used now intraoperative, and that was a breakthrough actually. You're seeing the whole retinal and choroidal vasculature while you're working. Injection. The BBG trypan blue can be injected under air or fluid. The fluorescein, of course, is IV, and TA is a suspension in the vitreous cavity. This is a brief about the concentrations of each one. The TA is 4 milligram per milli, the BBG is 0.025 to 0.05, Japan Blue is 0.15%, and fluorescein is 10%, meaning 10 milligram per milli diluted 1 to 5 to 1 to 10. The keywords. TA is suspension for the vitreous, BBG is a dye for ILM, Japan is a dye for epiretinal membrane, lens capsule in general, but without matrix anterior lens capsule, PVR plus minus ILM. Fluorescein is for the vasculature. Thank you.